thank you very much for the invitation of AIDS Concern to invite me to share with all of you and some of the work which was initiated by the Advisory Council on AIDS ACA in the past, and we are looking forward to actualizing some of the strategic recommendations in the coming years. But to start with, I really enjoyed the lecture of Professor Jung. Okay, to give you some kind of information, I just write a very little article and submitted, which is one is divided into two, is about 健康公平. Okay. There's health 健康公平 in the Hong Kong Economic Journal. Is Sun Bo. The first part has already published, but the second part will be published, I think, tomorrow. Okay, you may go to the website of Hong Kong Economic Journal and use my name to Google to search, and you may read my very short, humble article concerned about 健康公平. To start with, when I wrote an article, which is a CME article submitted to the Hong Kong Medical Diary, on HPV vaccination, okay, and dating back from many years ago, okay, and I think this is more than 20 years ago. The term health equality was used many years ago. Okay, I read the term health equality, but somehow in the recent articles, the term health equity was used. Okay, it comes across my mind. Why? What is the difference between equity and equality? I start to search in Google, and I learned a little bit of the differences between. I read the three photos, the baseball, the football with the fences, okay, and use it as an example to illustrate what is the differences between equity, equality, equity, and eventually what is meant by justice. Okay, in the context of HPV vaccination, we're talking about what is targeted. In the country, we are vaccinating the primary school girls only. Okay, the P5 the first dose is P5 and the second dose is P6, primary 5, primary 6. But we're talking about whether we need to have a catch-up program. We're thinking of whether we should implement a so-called gender-neutral vaccination, and that's what about the health equality and equity. And the little article I published to Hong Kong Economic Journal is about the access to the very expensive novel treatment for a skin disease, psoriasis. Okay, what happens to this group of patients? The access to this type of novel biologic treatment. Okay, if you're interested, you can go and to have a read and give me some kind of feedbacks to let me learn more. I learned a lot from Roger this morning. Okay. Yes, next time. Nick. The green button. Yes. Thank you.
Okay.
Yeah. Okay. Okay. This is my background. No, because they're given the interest of time, I will make my presentation very quick because some of these important concepts have been gone over by Professor Jung. Okay, this is a quick revision of current landscape and HIV, ACA, Hong Kong AIDS strategy 2022 and 2027. And this is the latest. Okay, this is this is the local HIV/AIDS epidemiological data. Some of the epidemiological data. You may notice that at 2015, the peak we have just passed the peak of the HIV, And in gist, this is a summary table. I'd like to highlight some of some of the important key messages in this table. It says male is the predominant group of people infected with HIV, but we have a substantial portion of female. And then most of these local cases are ethnic Chinese, and the route of transmission is through sexual contact, in particular through men who have sex, amongst the MSM. We have a small proportion of people contracted HIV through needle sharing, the people who are injecting drug, the people who inject PWID. And the mother, we have a sporadic report of mother-to-child transmission. Okay, and this is a summary of the extract of this from some of the table. And the preference of the local study by PRISM is a local study, which is the estimated preference of HIV positive among the MSM communities is about more than 6%. Okay, but one of the important observations in our data is more than 40% of local cases are late presentations. Okay, late diagnosis, late presentations. And the performance of the treatment cascade in 2020 is roughly, the denominator is 8,000 people living with HIV/AIDS, and 94% of those people living with HIV/AIDS were aware of their positive HIV status. But I have a puzzle, but I'm not quite sure how to explain. Should the percentage is so high, 94%, how to fit in the data, the observation of more than 40% of them are late diagnosis? There must be some kind of missing knowledge gap between these two figures. We have to look into it, whether look into it to explain the so-called seems to be a little bit discrepancies. And 84% of these cases, they have access to already started on antiretroviral treatment. Okay, but supposed to be more than 90% because it is very likely those who do not started on the ART in the local medical health services, they may not be the long-term local Hong Kong residents. So they have a positive test, but somehow they will leave Hong Kong. So I believe that this indicator we are also achieved the 90% 90% goal. 90% of those who are on treatment has been the virus well suppressed. And up to date for those who are working not in the non-local in this room or maybe some other internet. Okay, internet. In Hong Kong, the government provides antiretroviral treatment. It is up to standard. Okay. It is almost in the forefront according to international standard at nominal charge. Okay, the charging policy in Hong to this group of people is something like as if we're taking care of patients with diabetic hypertension with the nominal charge. Okay, and even then we provide there is a safety net. This is free of charge. Should they passes the means test by the social welfare department, the level of support. And just Bonnie gave us the inform the audience that there is a developing one-stop comprehensive medical link up to prevention, medical care, and everything. That software is developing in the special preventive special preventive program. Yattong. They're developing. They're getting add on more and more with the gain of experience. And if you're interested, I would give you. If you are interested, you may just contact Bonnie to ask for a visit. Okay, ask for a visit to the Yattong clinic. Okay, should you have a good link with the MSN community? I think if Bonnie will welcome the visit by the MSM. Okay, for the service. Okay, am I right to say that, Bonnie? Yes. Okay, and this is the quick highlight of the current landscape. This is the shot of the so-called the players, the key players. Okay, this you may read. Okay, you may read from the strategy published on the internet, but I give you a highlight. This is a CHP Center for Health Protection, DHO Health Bureau, and others government. The SPP, the Special Preventive Program, provides, it's a clinical program, public health program, clinical program and public health program, provides the policy support researchers, and also to support the scientific committee on AIDS and STI, and the advice part and partial before it is fully supportive the AIDS Trust Fund, But now we also support, but slightly different. But the CHP have a separate team to support the ATF, the AIDS Trust Funds. Okay. And the clinical services are also provided by PMH and Queen Elizabeth Hospital. And there are other, it's not directed to people with HIV, but some people at risk, the so-called vulnerable population. Okay. This term, vulnerable, may not be so welcome by some of the people, some of the workers or the people themselves. But I still use these old terms, okay? And the social hygiene service and the narcotic division administration, the methadone program, the tuberculosis, TB and chest services, social welfare department, education department, they're all providing different kinds of, they have participated in the local HIV programs in different manner. And the Advisory Council on AIDS, okay, we have from stakeholders from various backgrounds, including Professor Sun, okay, from the CUHK. They, you know all this, Professor Sun. He is an academician with interest in gender issue and sexuality, okay, and a wide participation by different backgrounds. And the AIDS Trust Fund, well, the AIDS Trust Fund there is three regular committee and one special project fund, which is an ad hoc one. And the EGP, it means the extra payment, okay. Extra payment committee and the publicity and public education committee and the medical service and support committee. These committees are represented, the committee member represented by, okay, and chair and represented by mostly non-governmental members. As it's a little bit, this is not 100% governmental. Not 100% governmental. They do all this vetting to vet the project submissions and then grants the funding to support these activities. And from the financial year 1993 up to the financial end of financial year last year, okay, slightly less than 1 billion, less than 1 billion have been already funded to support various projects, okay, including all these in work concerned about people living with HIV/AIDS, people who injecting drugs, ethnic minority female sex worker, and the male client female sex worker, the transgender, and others. And more, this is some of the more than 2 million condom has been distributed, but in fact, much more than that. Okay, this is the content distribution. This is all funded by AIDS Trust Fund. But there, a lot of the NGOs, they have received support from the other funding, including, the famous condom producer start with the D. Okay, okay. They donate in some point of time to donate the condom to the NGO for them to distribution. So the condom distributed should have been much more than above 2 million, and in context of outreach, and more than 700,000 HIV tests has been performed. As I said, should be much more than that, because some of these testing are not directly supported by ATF, but initiated by the NGO themselves. And this is the But the point is these funding projects, this funding project, not written here, is plot by project and by project basis. It causes some of the challenges of the NGO. Okay, this is what are the challenges for the NGOs? It is whether it is very difficult for the NGO to have a relatively long-term planning, staff development. Okay, and very difficult for the NGOs to train the staff, to retain the staff, to train the staff. Yes, neither, not his. Okay, this is the challenge. Okay. We have the NGO participate lots, very important stakeholders. Mainly in the local program is the so-called ACE, the NGO with specific interest in HIV/AIDS. The participation of the mainstream NGO plays a small part. Mostly. It's up to date. But connectors, the NGOs are very, very, very important. Especially the people, the guy who really directly reached to the community people and if they do the frontline work, they really go to the bars and saunas, and to directly talk to the say an MSM, talk to the attendants, the service user of this sort, the gay bar or the gay sauna. Okay, from one time, this is a story. That's some years ago. Okay, the controller of Center for Health Protection, said to me that, well, Dr. Ho, you can actually go to if you are being invited to the gay bar to give a short talk about HIV/AIDS prevention or whatever, you are welcome to do that. Okay, but eventually, if somebody asked me and I filed an application, and it is not so welcome. Not so welcome. After very serious consideration, as a government officer, they at the high level, they have the really other considerations of inviting of a government officer to present to a talk directly to go to gay sauna to engage in this health promotions activity. Okay. And the NGOs, in particular, is concerned. Okay, they have very innovative idea. They're very innovative idea in their promotional material, which is quite welcomed by the community people, such as the Tong Sing. Remember? Okay, Tong Sing. Okay, John, you know Tong Sing, the Tong Sing, and 恭喜你有梅毒. Okay. Okay. For somebody who doesn't understand what is the Tong Sing, why it is so interesting, and what is 恭喜你有梅毒. Okay, the AIDS concerned work will explain to them why it is so innovative, so interesting. Instead, some of the older the government produced that our staff could be quite innovative, but at the same time we have very safe. We have to be very careful not cross a little bit the line, and then otherwise, we will be in trouble. And this is innovation, and the NGO, they have a efficacy role, the efficacy role. Okay, and but for the efficacy, to sidetrack a bit, here I will talk about the slide later. Once show the messages in this slide later. Okay, the target of your efficacy work. The target of your work is who you are going to lobby, and what are your target audience? What is the target audience? I suppose your target audience is not Donnie. It's not me. Okay, because we are in the same team, in the same boat. We're same boat. We know everything. Okay, you have to. Okay, so in your efficacy work, remember your strategy. Okay, your strategy. Okay, and the challenges, we have long list of challenges. Long list, I saw the dot in the front and dot at the back of this in this bullet point. Long list, and but I just highlight some of the very important challenges is include engagement of and support by stakeholders who actually have interest but not interested. The first interest is 切身關係, 利益關係. Okay, who are these stakeholders who have the 切身關係, 利益關係? Everybody. Everybody you do. The local society, everybody in local society, including the common people, the lay people, including the government officers, including the management of the big giants, the industry, the pharmaceutical industry, and the commercial industry. Everybody, they should have 利益關係, 切身關係. Am I right? Okay, but not interested. Okay, you know what I mean. Okay, these are the important stakeholders. Okay, they're not interested, but 感興趣. We have to do that. Okay. And social marketing of the whole HIV/AIDS program. We are not very successful, say, in Thailand. In Thailand, they have launched a very successful condom social marketing, okay? Okay. The terms, I learned this term social marketing, dating back from sort of 30 years ago when I started in my HIV, when I was, deployed to SPP, to engage in HIV work. Okay, interesting term, social marketing, the condom social marketing. But it is not only the social marketing, not only limited to condom promotion, but for the whole HIV/AIDS program. Okay, this is very challenging. And the direct and active involvement of the targeted community people, the community people themselves. And then we have to engage them and obtain the support. Okay. These are the important challenges. And this is the current HIV response in Hong Kong. You know, the big circle is the whole society. We are the people at risk is a subset of the people in the whole society. Now we're doing the promotion, the behavioral change, the change of behavior, the condom promotion, the empowerment and everything, testing, and providing the HIV combination prevention, patient center, harm reduction, approaches, and then eventually pick up, that first diagnosis who have HIV and link them to treatment, and then we can use the prevention treatment as prevention approach to achieve the U equals to U and the holistic care, incorporating the targeted prevention among the people with an HIV, and just as Roger said, which we're doing to trying to shift the bell curve, the normal distribution curve from the high risk or at risk back to on the left side of to become sort of approaching the normal risk curve. Okay, this is I just learned from Roger. This is a shifting of the curve. Okay, and we are able to sort of achieve the triple 90. Targets proposed by the UNAIDS. This is a summary table of this is all with figures. This is specific and measurable as a program surrogate indicators. Okay, you see this is the coverage, the number of condom, the coverage, the number of tests, the number of condom distributed, condom usage, and this is the summary statistic. Okay, have a look. Okay, this slide will happen again. Okay, later. Okay. And the terms of reference of Hong Kong Advisory Council in AIDS to keep review local and international trends and development relating to HIV infection and AIDS to advise government on policies relating to prevention, care, and control of HIV infection and AIDS in Hong Kong, and to advise on the coordination and monitoring of programs on the prevention of HIV infection and provision of services to people with HIV/AIDS in Hong Kong. This is the terms of reference of the Advisory Council on AIDS. I believe the key to success relies on wider community engagement, multi-sectoral, disciplinary organization, departmental, industry, national funding, lots of multi-sectoral responses, and active and even proactive participation, communication and collaboration by people who are are affected by HIV. Okay, this is the 2027 strategy. Okay, this is the approach: evidence-based community participation, the accessible and affordable by affected communities and whole society, cultivating a supportive and enabling environment, prioritizing funding and resources. This is the guiding principle. This is this slide. This is a recap of what we are doing. It's a so-called this is the community participation. But this is a recap. Okay, we have engaged the relevant NGOs, and different groups of consultation meetings, in various sections of consultation meetings, gather all their inputs, and the secretariat have summarize, collect and summarize their inputs, and eventually prioritize. And this is the effort of the community. The effort of the community. This is the way we try our best to engage the community to have their view and inputs to put up and consolidate in the strategic paper. Okay, in gist, red, highlighted in red. The strategy is not my strategy, not the advisory council and its strategy, but the strategies of us, me and you. Okay. This is the strategy of the community. It is not only the strategy of the advisory council and ACE. Okay. And this is very, very busy. To summarize, we have one vision. One vision, 30. One mission, 30, 4 objective, 6 target group, 8 strategic area, and 10 circle indicators. Okay, just like propaganda, very easy to remember. It's one vision, 30, 4 objective, 6 priority group, 8 strategic area, and 10 measurable indicators. Okay, I'm not going to given the interest time, I'm not going to give individual detail of this detail. And yes, this slide pops up again. Okay, I will draw your attention to the red highlighted thing. Okay, for this is what we have done in the strategy in 2017 to 2021. But now we have a new strategy from 2022 to 2027. We have there in the so-called strategic area. There is 3, which is not mentioned. This is not mentioned in the report. Okay, is this 3? Enhance, promote youth health, sexuality education. Reduce and eliminate HIV-related stigma and discrimination. Mobilize the collaboration between government and the wider community, society to create change. These 3, okay. That is, well, I'm sure in the year 2017 and 2021, okay, we are doing this 3 already. But for some reason, okay, we are not able to consolidate into figures, to tell people what we have done. And by the end of 2027, we write down, a new term of strategic paper at the end of the 2027. I'm not quite sure whether we can put some of the indicator or a few words about what we have been done in this 3 particular area. Okay, this is the 10, the 8, the measurable indicators. Okay, this is very boring. Okay, you can go to the original papers to the strategic paper to individual to read them. Okay, but basically, there's a 90/95 and +1 the 90% and the 90/95 goal. We set it on in this strategic paper. We believe that, well, this is the evidence base, and we are continue to, we are going to continually monitor, evaluate the effectiveness, and strengthen our partnership and connection with you and the community peoples. And well, I spent a very short time on the hot topics in ChemFund and ChemSex. This has been discussed in one of the meetings. It discussed in one of the meetings on the Advisory Council on AIDS. Okay, thanks, Lisa, Dr. Yip. Okay, to making the presentation in the Advisory Council on AIDS. This is some of the highlights. Okay, about ChemSex, which is a very important emergent issues to be and challenge we are facing now. Chemsex refers to the use of drugs in a sexualized context by gay and other men who have sex with men, where specific drugs are used before or during sexual activity to sustain, enhance, disinhibit, or facilitate the experience. Basically, okay, the specific drug is mainly crystal ice, the GHB, G 水，大家知呢個嘅有個本地嘅名嘅，叫做咩啊？迷。Okay, yes, okay, 迷姦水 okay. This is the specific drug and the methadone, and this is specific drug are concerned. Okay, well, we know that, okay, there is so-called the negative effects of the chemsex is physical health, in terms of the during sex, in terms of the toxicity, the organ-specific, the neurological, the neuropsychiatric and adverse effect of these chems. And during the chemsex, we have good evidence to show that there's a high frequency of high-risk sexual behavior, including the number of sex partner, group sex, unprotected anal sex, and transactional sex. And this is the frequency of sexual behavior, and posing them at higher risk of contracting the all kinds of infection, sexually transmitted infection, hepatitis B, and hepatitis C, and HIV, of course. And the mental health issue, which is a cause and a result of the use of this substance. Okay, to start with, this patient may have depression, anxiety. They have some pressure, social life pressures to start with. So they engage in chemsex. But this kind of mental issue can also be a result of chemsex. This is mutually reinforcing type of relationship. This is the scenario. This is the 6-1-year and lifetime chemsex preference among MSM. This is a local data. Was estimated to be 12, 15, and 6 to 19%. Okay, it is not low, which is not low, but I have no idea whether it is an underestimation or not. But this is the result of some local study, and the chemsex is linked to the social media and gay social networking apps, okay, and social networking apps. So this is some of the findings derived from this from the local surveys. And the psychological factors such as relief of pressure, curiosity, and boredom contribute to the practice of chemsex. Okay, but the question is whether chemsex can eventually address their pressure, can address their boredom, can address their neuropsychiatric status. The answer is I don't think so. Okay. This is also the data from the local study. The gist in the messages here is for those for those who have people living with HIV, they have a reported drug use behavior. Okay, and polydrugs is common, but
there is 1/3 of them had coexisting mental illness. Most drug users never receive any form of drug treatment services. Okay, this is not only limited to the people living with HIV/AIDS who practice chemsex, but also for those without, not yet have infected with HIV/AIDS. The usage rate, the utilization rate of the drug treatment services was low. Okay, so in the strategic paper, it recommended integrated and multidisciplinary team approach to address this group of the chemsex issue and the capacity building. The capacity building is, this is something that I observe, is one of the NGO, the AIDS NGO, by training, they are not so well trained in counseling and capacity building, counseling and handling people engaged in drug using. For the conventional NGO who have focused on, say, drug abuse, so drug abuse, okay, the conventional NGO, they are not so, there's no well trained in HIV/AIDS, the gender issue and the HIV/AIDS issue. So we need to come together, okay, to mutually learn from each other, or to, if possible, to work together, to work on this group of, in this strategic area, okay. And the simple things is to also to let the AIDS services, including the clinical services, to facilitate early referral, pick up the patients and make appropriate referral, okay, to facilitate and to smoothen this route of referral. Okay, and the challenges here, this is about chemsex, digital channel format of networking, and this is one of the challenges. This is not only for chemsex, this is for HIV/AIDS in general, the digital channels and networking, and the recreational drug MSM, the EM, late diagnosis, aging, inclusive society, okay. And the PrEP issues are all the challenges we are now facing, okay. Okay, this is clear player, but just give a clear player. But I want to recap here is the wider society, Don't forget those who are not interested, but have competing interests. Okay, almost finished. Yes. From the perspective, I'm used to be a government officer. Okay, I'm used to be a government officer. Now retired. Okay. In doing the so-called every year we have to write the project submissions to ask for funding, project the service development. We are facing the dilemma of allocation. Whether the money should be spent more on medical and health, housing, education, every welfare development. This is competing interests. There's somebody here. Okay, 5分事, okay. You see 5分事, okay. Okay, and then we have in coming back to the medical and health is whether we spend more money on prevention and on treatment. Okay, in terms of treatment, this is treatment for rare disease, and the SMA issues. Is the treatment is in terms of $1 million for one patient, and this is for rare disease or common disease. Should we spend more money to better improve our diabetic service, and which disease? Okay, not mentioned, including AIDS and HIV. Okay, and treatment and rehabilitation, psychosocial well-being, the mental health issues. Okay, a large black hole. Right now, to attend more patient or versus spend more time in an individual versus health promotion, prevention versus research. These is all competing interests, and how to convince the budget holder and the public that the public money should allocate to a particular public services or policy. This is not only your difficulty. It's also my difficulty, okay? Or when I was a government officer. Very difficult, this is something happens. This is illustrate. This is, 5 biscuits and 2 fish. 5 biscuits and 2 fish, you know that, okay? And we are competing in interest. Okay, whether it is wrestling or we join hand in hand, or we are playing the tango. We are playing the tango. But I think we have to sit together and to better talk and communicate with each other. Okay, this is the last slide. The last slide. This is about the normalization. This is inclusive normalization that we cannot differentiate. You create a pattern, this type of pattern. Okay. It's very difficult. It's not difficult, but some people like to have this kind of pattern. It's so fully 全融合, fully inclusive. But some people, they like to remain their unique identity, segregate and create unique identity. Okay, well, which is the best? But we know that from the audience perspective, like you, do you like this pattern, or this pattern? Some people, they like this pattern. Some people, they like this pattern. Okay, it is very interesting. Let's think about it. What we are doing, what we should do. Okay, thank you.